Good morning, Vanessa.
Good morning, Cara.
Bright and early here in California, and I'm ready to talk about testicles.
I mean, when are you not ready to talk about testicles? Let's be honest.
It's very true.
And when you live in my house, where there are lots of pairs of testicles, they're sort of like an everyday, every moment conversation. I mean, it's like I feel right at home having a conversation about balls.
Which is so funny because we hear over and over again that no one talks about boy body parts. And yet, I would argue that testicles, which we are going to refer to by their much more commonly used name balls for the rest of this episode, or for much of this episode, they're talked about all the time.
Right. Except as we say in our keynote, and we say this to parents and educators, and especially to kids themselves, they're often the butt of a joke. Sorry for the mixed anatomy metaphor.
Yes.
They're a punchline, right? And male anatomy is a punchline, male physiology, things like erections and wet dreams.
Right.
And the sensitivity of testicles, which will become important as we have this conversation.
Another pun
and
I'm rubbing off on. Oh my gosh.
I mean, yeah. Cara, it's catching. It's like osmosis, pun osmosis. But there's two reasons why this conversation is super important. One is so that you know when your kid might need help and you know how to communicate with your kid who has a penis and testicles, how to be aware of their own bodies and when it actually might be an emergency situation having to do with their testicles, but also so that they know that their bodies are not a joke, that they're something to be respected and learned about and cared for. And we get that message to girls, but we're really not that great as a society of getting that message to boys. So there's a little bit of a PSA here. And what I will say, Cara, before we dive in to the subject, is that when we say that to a room full of middle schoolers or high schools, when we talk about how boys deserve the same information delivered in a serious way about their bodies and what happens with their bodies, the room goes silent. Like it's so clear that they feel seen.
Yeah, good silent, not bad silent.
Well, good
like
silent,
curious silent,
but
thank
also
you
shocked
silent.
silent. Like, oh my God, no one's ever said that to me. They just like have made a joke about my body, but they haven't actually said my body deserves like real, earnest, science-based conversation.
Totally. And I want to do one other call out at the top before we get into this content. And that is to say that our listeners they come from all over the world, which is kind of amazing, and all different walks of life. We happen to have a surprisingly large audience of male listeners. Surprising because we fall into the bucket of parenting content, which I take issue with, but let's just say we're in the parenting bucket. And, you know, men tend not to be big consumers of parenting content, certainly not of parenting audio content. And yet, and I would argue this is why we don't fit into the bucket of parenting. And yet our content is about so much more than just the verb of how to be a parent. And so we seem to draw a very large male audience. For those of you who grew up with testicles, so much about what you're going to hear in this episode is going to feel relatable or answer some questions, or maybe you know this information, but you start from a place of being maybe a little more comfortable getting into these kinds of conversations with the sons in your life, the boys in your life who are growing up with testicles, because you have them. And having these parts, there's an experiential learning curve that people who didn't grow up with testicles, like the two of us behind microphones today, we don't share that lived experience. So to the women who are listening, and there are a lot of you, we say this: just because you don't have them doesn't mean you can't talk about them. And like everything else in the world, you're going to do your research and you're going to educate yourself, and you're listening to this podcast, which is partially in service to that. But this is a great example of how it feels for men who want to talk to their daughters about things like periods and they don't know how to go about it because they didn't grow up having the experience. This is sort of the shoe is on the other foot. And so welcome to the feeling of, gosh, I don't even know where to begin, which is a little bit of what landed us all in this place to begin with.
So we're going to go through a little bit of anatomy, and then we're going to go through some physiology so you can understand kind of what's quote unquote normal or expected and what should be of concern. But I want to point people to two places. One is to our less awkward essentials, where we literally have a lesson in Less Awkward University that walks through the male reproductive system. It has diagrams, it has descriptions, it has all the things we're about to talk about, and it has prompts for you to have this conversation with your kid. And in that lesson, there's also a link to episodes we've done in the past related to penises and testicles and erections and wet dreams. So you have that all within easy lessoning in the Less Awkward Essentials. Because this is going to go quickly, the first half, so we can get to the second half, which is really about testicular emergencies.
So we're going to take this really quickly and just do an anatomical overview because you can find the information elsewhere. And then, Vanessa, let's spend most of the time talking about what's an emergency and what's not when it comes to testicles.
So from the minute babies are born with testicles, they're kind of fascinating because your son comes out with testicles that are much bigger than you expect a baby's testicles to be. Let me tell you, I was not expecting that size testicle on my newborn. Cara, can you
Vanessa,
just
I don't want to embarrass you, but everyone's different and sizes really range. And that may not be everyone's experience. But some boys are born with larger testicles. Some boys are born with smaller testicles. The most important thing is that when there is a scrotal sac and a penis, and I'll give you 2 seconds on the scrotal sac in a minute, then you need to make sure there are testicles there.
Two testicles.
Right. So you'll see that when pediatricians first come in and examine a newborn baby, they're actually not looking at size or anything like that of testicles. They say 10 fingers, 10 toes, 1 penis, 2 testicles. That's sort of like the numeric for an XY baby. That's sort of how things should add up. And we've had conversations at other times and in other places about when the genetics don't line up, and that is not the anatomy that a kid is born with. But we're just going to talk about kids who are born with typical penile and testicular anatomy. So testicle size can really vary from kid to kid, but you want to make sure that the testicles are actually in the scrotum, because when they form, they do not form outside of the body in the scrotum. They actually form inside the abdomen, and then they descend. And sometimes they don't descend when a baby is in the womb. It takes a little bit, and they descend after a baby is born. So there are some kids who are born with quote unquote no testicles, but in fact they have testicles that are up closer to their abdomen and they haven't yet descended. And we're going to talk about undescended testicles because it becomes a flag for other things down the road.
The other thing that those of us who are not medical professionals might be aware of is the reflex in the testicles, which is called
Cremasteric reflex.
Yeah, that just trips off the tongue. And that reflex is like when you're changing a baby's diaper and your hands are cold and you see the testicles kind of retreat, or you're giving your kid a bath and the water's too cold and the testicles retreat. And as one of my kids likes to say, the penis doctor taught them that the reflex there is similar to reflexes in other parts of the bodies. And I don't think kids are aware that that is a reflex.
No. And in fact, you may notice when a little baby is being examined, a doctor or healthcare provider will rub the inside of the thigh about 2/3 of the way up, sort of between the knee and the hip, about 2/3 of the way up. And that is where you can elicit the cremasteric reflex. So you can rub that part of the thigh and watch the testicles run up out of the scrotal sac. Testicles move. They hang outside the body when they need to cool themselves off. And they go inside the body when they need to heat themselves up. I mean, it's like a wild, wild phenomenon, but you can elicit that reflex by stroking the inside of the thigh.
The other thing that's really cool about testicles, and it's not all the jokes that get made at the dinner table about testicles or balls, as kids say, is that they are actually sort of parallel organs to the ovaries. And if you look at a diagram of male reproductive organs, if you look at it not from the side view, which is how people are often shown it, but if you look in our male anatomy lesson, if you see it from the frontal view, and this is how we also show it in our curriculum, both frontal and side view, you notice how parallel internal female reproductive organs and male reproductive organs are. And so it's not just cool because you're like, oh, the body's so unbelievable and nature is so unbelievable and these look so similar. But it's also cool because, again, people don't show kids that view of male anatomy. People don't realize how similar they are. They don't realize how there's like real kind of complementary functions and realities that happen between the two, a male anatomy and a female anatomy in terms of these organs. And it's just like really neat to notice it because it gives people empathy and understanding of each other.
I mean, it's very fundamental, right? And whenever we're on stage and you get a question about this, I love how your face lights up and you talk about it. The two testicles, they are very, very similar in shape and essential function to the two ovaries. And they sit in the same vertical line, sort of in the same general area. They're just lower than the ovaries sit. They are connected. Those testicles then have these tubes, right, called the vas deferens, that those tubes connect them from the testicles all the way up and around to where now you're going to have lots of liquids flowing in to make semen. So they in front of the bladder and in the area of the prostate gland, they kind of connect in. What do those tubes look just like? They look just like the fallopian tubes, right? I mean, yes, but no, they have different function, but anatomically, the origin is the same. You are right, Vanessa. And it's that same sort of two ovals with then these spaghetti-like lines, right? Connecting them to a central hub. And that central hub is where it all comes together. In the female anatomy, it's meeting at the uterus. In the male anatomy, it's meeting right sort of as everything is diving in and through the prostate gland, but it's really similar. And that makes sense, right? Morphologically, we all come from the same sort of core.
I think people maybe are wondering why my face lights up when I talk about that. They're like, really? That's what? Well, but it's what I love about it
you're
is
Dr. Vanessa Kroll-Bennett,
right? Because I'm an honorary doctor, but also because I feel like the more people understand our commonalities and our similarities, whether it's biological, whether it's other kinds of shared experiences or similarities, the more we can empathize with each other and appreciate each other and be kind to one another.
That's
right. This is an age, right? So as we move into talking about puberty and kids' physical development, which is a very sensitive age, it's a time when we really need that empathy and we really need that kindness, and we hope that kids have it. One of the fascinating things about testicles as it relates to puberty is this is where there's actually a divergent road between female physical development and male physical development, because as anyone who's listened to this podcast for the last 4 years knows, the first sign of female puberty is our breast buds. And those suckers poke out of everything. Like the entire world knows that a girl has started puberty because her breast buds, unless she wears like 18 layers that are 12 sizes too big on her, you can see those breast buds everywhere. But the first sign of male puberty is growth in the testicles and the penis. And number one, there's a private place for boys, particularly at that age, and they're not walking around with those things hanging out. But number two, that growth is so slow. And so even from day to day, a kid or a parent, if they even have a chance to see their kid's growing body, may not know that growth is happening.
So there's slow growth of these moving parts that are inside the body, outside the body, inside the body, outside the body. And these parts are asymmetric. They might be slightly different shapes. They might be slightly different sizes. They hang at different levels, right?
Does that sound familiar to listeners? How about labia? How about breasts?
That's right.
How about ears, right? So it's super important that the boys in your life know that testicles are not meant to be perfectly symmetrical or hang at perfectly the same height, particularly as there's a lot of moving parts happening.
A lot of moving parts, and they can be lumpy and bumpy. And it's very important to recognize that while we imagine these as sort of perfectly smooth orbs, they're not. And if you go back to that anatomy lesson and you look at the image, what you will see is the testicle itself is sort of egg-shaped, if you will. It's oval and it's sort of always drawn with a slightly more pointy top and a flatter, rounder bottom, although it might be more perfectly ovular than that. But then running outside the testicle, the place where the sperm, once it's produced inside the testicle, the place where it collects and matures is called the epididymis. And the epididymis can feel like a lump. If someone is examining their testicle and suddenly runs their finger up against the epididymis and has never done that before, they may panic. In the same way that breasts can be lumpy and bumpy, so too can testicles. So lots of variability across different people, different testicles, in the same body. And there's lots to know when it comes to what's, we hate this word, but what's normal.
So Cara, a question that we get a lot, we as in you, and something we've covered on social media to viral sensation is that lump on my testicle cancer?
Yes.
But there are a million other questions that relate to potentially emergency, potentially not. And you just described the epididymis and how, as it feels to someone touching a testicle, it might be a little bit feel like a lump on top. So do you want to just start there?
Yeah. So let's start with lumps and bumps, and then we'll go to when you need to go to the emergency room, right? Which turns out to be two really different lists of things going on. So when there are lumps and bumps on the testicle and you don't know, is it new? Is it normal? Do I need to worry? Vanessa, what should you do?
I would start out by seeing if there's a lump or bump on the other side.
Oh, I love that. Very, very thoughtful, because if there's a matching lump or bump, it's pretty reassuring, right? Yeah. What else could you do?
I think if you're a kid, you want to go speak to a trusted adult. Mm-hmm. Hopefully, that's a parent or guardian. For some kids, it's not that person. It might be the school nurse. Mm-hmm. It might even be a sports coach. Those are people who are not going to, examine a kid. So this is a great opportunity, if you have a growing kid in your house, to say to them ahead of time, hey, if you ever notice anything with your body that you're not quite sure is how it's supposed to be, you can always come ask me. And if you feel funny asking me about it and you just want to see the pediatrician and ask them, that's great. I will make an appointment and you can have that conversation.
I love that advice because what it does is it allows for a relationship to be built between the kid and their healthcare provider. And instead of just going in for those regular checkups once a year, and I only have 10 minutes to ask all the questions that have accumulated over all this time, if there's something that's worrying you, yes, you go to your trusted adult. But your trusted adult, when it comes to the penis and the testicles, they're calling the pediatrician. It's appropriate. And so, as the adult in the room, when you hear this, the most common thing we hear as pediatricians is, I don't want to bother someone. I don't want to bother them if it's normal. It's not a bother. So call if you have a question about a lump or bump. There are two main things that cause lumps and bumps other than feeling the epididymis. So one is a hernia. So a hernia is essentially just a hole that allows for a little piece of another organ, usually it's a little bit of intestine, to poke through from where that organ normally sits to where it shouldn't be. So if you think about an umbilical hernia, which is a hernia in or around the belly button area, what do you usually see? Like if it's at the belly button, you might call it an outie, right? What is it? It's literally that where the tissue called the fascia that's supposed to hold together, keep everything inside the abdomen that's supposed to be in the abdomen and keep everything out of the abdomen that's not supposed to be in the abdomen. That tissue has a little bit of a hole in it, and the intestines can kind of find their way through the hole and they poke out a little bit. And how do we know it's a hernia? Well, generally speaking, when we examine someone, we can gently push on that area and it goes right back in. Or if the person coughs and they increase pressure, the organ, usually intestine, just pops right out, right? It's like a party trick. So you can have hernias all over the body. And one of the places that is very common is an inguinal hernia. An inguinal hernia is a hernia in the groin. Why is it so common? Because we just talked about how testicles go up and down and up and down. If they're able to go up and down, there has to be a hole through which they can go up and down. If there's a hole there, there is some easy access for the intestines to slip into that hole. I mean, that's a very base explanation. And if there's a gastroenterologist or a urologist or a surgeon of some sort listening to this, I mean, cringe away. But I think for all intents and purposes, this is what people need to know. And so at any age, boys, men can develop inguinal hernias on one or both sides. The classic case that you hear about is like with weightlifting or lifting a heavy object. There's a big, it's called a valsalva. It's a strain. It's when you push pressure and a little bit of intestine pops through because the hole grows a little bit and suddenly there's a lump. Why are hernias an issue? Quite frankly, they're not until the bowel gets stuck. If the bowel gets stuck, now you've got problems because the bowel can swell. The blood supply to that part of the bowel can get cut off, and you can start getting into some really sketchy territory in terms of health and wellness. So that is why at every checkup starting day one, pediatricians will be feeling for, in particular, inguinal hernias. They're just checking to make sure there isn't a gigantic hole where the bowel is going to come in and out. So that's one place you can get a lump and bump. The other lump and bump that people talk about the most is testicular cancer. And I think it's really important, Vanessa, for us to cover testicular cancer because it is a young man's disease. Mm-hmm. So it is relevant to our listening audience.
Yeah, I mean, it's interesting. I spoke to a family recently, and the kid was a cancer survivor and had testicular cancer. And one of the newer protocols that has been put in place, at least in the sort of New York area hospitals, is to figure out ways to help protect the fertility of a kid who may be going through treatment for testicular cancer. This is a very evolving area. And Kari, you can talk about sort of, what we know and what we don't know with all kids who are child cancer survivors. This is something that in the stress of the moment, one might not be thinking about this topic because God willing, you just want your child to survive and thrive out the other side of treatment. But it is a topic that's becoming more front of mind with healthcare professionals.
It is. And let's talk about the cancer diagnosis and the stats first, and then let's circle back to fertility because it's extraordinarily important that we mention it. Someone listening to this podcast will at some point in the near or distant future be dealing with this, and hopefully this advice will filter back into their brain. Okay, so we call it a young man's disease. The age range for diagnosis in general sits somewhere between age 15 and age 45. Doesn't mean it doesn't happen to people younger than 15. It can. It doesn't mean it doesn't happen to people over 45. It can. But the vast majority are between 15 and 45. If you're looking at the teenagers in that group, only about 6% of the entire group who are diagnosed with testicular cancer are teenagers. So it's not a large number. There are about 10,000 cases a year in the US, right? So we're looking at 6% of that are teenagers, but that's not nothing. And I think it warrants conversation because there are things that kids can do in order to be aware of testicular cancer. And testicular cancer, when caught early, is extraordinarily treatable. So it's the most common solid tumor diagnosed in men. If it's caught early, the survival rate is 99% or greater. And the cure rate, which means, you can survive something but not be cured of it, the cure rate is 95% or greater. So basically, just like we tell girls, starting when your breasts develop, get your hands on them and start doing self-breast exams and start learning your normal lumps and bumps, and then flag it when there's an abnormal lump and bump for you. We should be giving boys the same advice.
Although it's funny because they don't seem to need the advice about getting their hands on them frequently.
Fair point, Vanessa. I think the goal might be a little bit different. Right. The data collection might be a little different, but yes. Just a quick flag for those who are wondering why someone might be at increased risk for testicular cancer. Your risk increases if you have a family history of testicular cancer. If you have a history of an undescended testicle, which takes us back up to the top of the episode, I'll get to that in 1 second. HIV is associated with testicular cancer. And being born intersex or having a sex chromosome anomaly, that is related to testicular cancer. I want to talk about the undescended testicles. This is a very, very big thing. Because remember I said the first thing that pediatricians do when a baby is born, they count fingers, count toes, and they feel for 2 testicles. And if the testicles descend in the first couple of days or in the first week or so, fine. If a baby is premature, it might take just a little bit longer. Fine. If the testicle remains in the abdomen, there is a very clear increased risk for testicular cancer. And what's interesting is that the reading I have done suggests that even if you bring the testicle down, and we're going to talk about bringing the testicle down in a second, that testicle is still at risk for testicular cancer. So having a history of an undescended testicle when you were an infant is something that's important to know about and to tell your healthcare provider.
Right. I mean, we've talked on other episodes about the importance of teaching kids about their health history and their family's health history so that they have reference points. Not everybody has that information because of, if they were made as partially by a sperm donor or if they were adopted. But if you do have that information, that's the kind of thing your kid should know so that they can advocate for themselves in a healthcare setting.
That's right. And to the point of bringing the testicle down, it may sound odd, like, well, didn't you just say they go up and down and up and down? They do, but when testicles like to live inside the pelvis and the abdomen, they get too warm. They're overheated, essentially, for lack of a better way of describing it. And they really do need to be brought down, and they can, you see a urologist and there's a surgical procedure, and those testicles are brought down into the scrotum. And don't ask me about the degree of movement after that surgical procedure, Vanessa, because I will not be able to answer that question, but it is better for that testicle to be brought down surgically than to live up in the abdomen. This is where it's not an ovary. Ovaries are designed to be up high.
Right. Okay. So let's talk about, the kid who comes home and is like, oh, my ball hurts. Or I think there's something wrong, or there's something on my balls, right? And I'm purposefully saying it the way a kid would say it, which is just like endlessly hilarious. I actually gave a talk, Cara, to like 100 teenage boys, and we were talking about hormone looping and testosterone and where's testosterone made. And, I was sort of warming up the boys a little bit, like getting to know them and building trust. And I was like, all right, guys, where is the best testosterone factory in the body? And one of the boys raised his hand, and he had this face like, I'm about to say something that I think is going to get me in trouble, but I'm going to say it anyways. And he was like, the balls? And I was like, bravo. Yes, we can say the balls. I was like, does anyone know the scientific term for balls? And the same kid was like, with gritted teeth, was like, the testicles? And I was like, yes. And I made the entire room give him a round of applause for saying both those words. And then we got moving. And then we were talking about testicles and balls and all that stuff. And it was like, it broke the ice, shall we say. So the kid comes home and he's like, oh, is this thing on my balls normal, or it hurts or whatever? But remember, again, they're at the age where they don't really want you looking at their balls, touching their balls, inspecting their balls, which, unless you're a physician, you're really not the authority on this subject. So,
and
Cara,
if you are a physician, but you are also their parent, let someone else put their hands. Right.
So the minute that question arises, not necessarily the minute, how do we determine, Cara, if this is my ball hurts, can you make a doctor's appointment for tomorrow? Or my ball hurts, I think we need to go to the ER.
Right. So when it comes to lumps and bumps, cancer in general, this isn't always true, but this is almost always true. Cancerous lumps and bumps don't cause pain in the testicles. And that's actually true in the breasts as well. Now, again, there are plenty of people who will say, no, my presenting symptom was a painful lump. So this is not true for everyone. But for the most part, there's no pain. It's just a lump. When it comes to hernias, a hernia that is not worrisome, that's kind of sliding in and out where the intestinal bulge is kind of coming in and out, shouldn't cause any pain. It's when the hernia gets stuck that there's pain. So, Vanessa, pain is really your determining factor. How quickly do I need to get in to be seen? Again, you should always go in to be checked if you have a question or a concern. But how quickly and where should you go? Do you call and make an appointment for 2 weeks from now, or do you show up in the ER? Okay, Vanessa, here we go with acute scrotum. Have you ever heard that term? It's not
I've never heard a scrotum called cute before.
It's not I knew you were going to go there. Acute.
We've had people say to us, please don't compare body parts to food. We've had other health and sex ed professionals say, you know what, like it's really not my favorite thing. But I'm like, how can you not compare them to food? It's so ripe for the picking. You'll understand that analogy in a second.
Such a bad influence on you. Go on.
I cannot eat ripe figs because they literally, to me, look and feel like testicles. I'm
what
just like,
this has to do with acute scrotum is beyond me, but this
because
is
you were calling a
excellent for
scrotum,
social media.
You were calling a scrotum cute. And the only time I've ever thought of a scrotum as cute is in its parallel reality as a ripe fig, but not like an actual scrotum. They're not beautiful
Do you
objects.
consider figs cute? Okay, we're not even going to go down this road. We're just going to say.
By the way, write in if you agree with me that a ripe fig is just like, I've had people say to me, now I can never eat a fig again. You've ruined figs for me when you made that analogy.
Oh my gosh, Vanessa and the implosion of the fig industry. So acute scrotum. Acute scrotum means I am having such tremendous pain in my scrotum. The scrotum, quick reminder, is the sac that holds the testicles and the vas deferens, the tubes that take the sperm up and out of the testicles on the sperm's way out of the body. The scrotum holds the testicles. And it is really important to understand there are a whole host of things that can make the scrotum feel acutely uncomfortable. So some of those things have to do with the skin of the scrotum itself. That we're not going to focus on that in this part of the conversation, but I think it bears listing. So a rash, an ingrown hair, chafing, anything that irritates the skin, the scrotal sac, can cause pain.
What do you recommend to prevent chafing if you have a kid playing sports in hot, sweaty weather, that kind of thing?
There are a lot of people who have a lot of opinions on this. So by and large, chafing comes from the combination of sweat and rubbing.
And we have done a full episode on chafing. So if you really want to deep dive on chafing, you can listen to that.
But it's really important to recognize anything you can do to minimize the sweat and minimize the rubbing. So to minimize the sweat, you air the area out. Can't really do that during sports.
Right.
When you get home, you can wear shorts, but or take a shower and air things out. But in general, you can't really air out in the moment very well. You can wear breathable underwear, which makes a big difference. In terms of the rubbing, it's really separating the scrotum from the thighs. That to me is sort of like if you're going to go for one plan of attack, which is why underwear that is brief or boxer brief style tends to pull the scrotum off the thighs, whereas boxers don't. And that's really the big difference. But boxers are more breathable and briefs and boxer
briefs. And what
briefs
about like A&D ointment or anything like that?
Big fan of ointment or powder. Now, when you talk to people with scrotums, they will say scroti. Anyways, they will say they fall into two camps. So there's the camp that wants something that is ointment based, and there's the camp that wants something that is powder based. The powder dries up the area, so it deals with the moisture more. The ointment lubes up the area, so it addresses the chafing more. You do you. Try and you do you. And by the way, as kids are growing and changing through puberty, especially if they're gaining weight as part of their pubertal growth, sometimes the chafing gets really intense, right? Because you'll have a new distribution of fat and skin and tissue and things rub that didn't used to rub.
And they might choose to suffer in silence and not say anything because they think either there's something wrong with them and they're scared to bring it up, or they did something wrong, right? That hygiene topic you've been after, that they somehow failed, or they're embarrassed about the fact that their body shape is changing and it's causing chafing. So again, this is a great opportunity for a sort of prophylactic conversation. Like, hey, your body shape is super different now. And it may be that parts of it are rubbing in new places, and that's fine. And there's no problem, but there's ways to actually help make that feel more comfortable. So we can talk about that.
And Vanessa, it's noticeable. Like you see your kid walking with really wide legs and they're trying to avoid or wincing, or their hands are in their pants, but it's a whole different situation. Why
but
their hands
not
are
in the
their hands.
relaxed way that you normally notice.
Correct. So there are lots of tells, if you will. I'm going to add one other thing to the list that people don't like to talk about, but it's a real thing. So you can get infections like lice or scabies, and these, or you can have bed bug bites or mosquito bites or spider bites. So these are things that really cause a lot of local irritation on the skin. So if you have a kid who's itching and scratching, ask them what's going on, how itchy are they? No judgment, no shame. That's a visit to the pediatrician, but it's not an emergency. Okay. Those are all non-urgent. Those are sort of skin and outside the scrotum.
Can I tell a terrible joke that my mom likes to tell?
Oh, geez. Here we go.
This is a real Lynn Kroll joke. So a man goes to the doctor because he has crabs in his pubic hair. These are the days when people still had pubic hair.
And they use the word crabs.
And they use the word crab. Was that scabies or crab scabies?
No, they're I think they're different.
Okay.
Oh, gosh. Well, you tell this joke.
He goes to the doctor and he's like, doctor, I think I've got crabs. And how do I take care of it? And the doctor says, well, you're going to shave one side of your pubic hair and you're going to keep the other side. And you're going to light one side of your pubic hair on fire. And as the crabs run to the other side that has no pubic hair, you're going to stab the crabs with an ice pick. Okay. Is there any, and then my mom would burst out laughing. Is there any wonder that I turned out the way
Vanessa,
I turned out?
I understand everything. I can't believe I never heard that joke, and I understand everything I need to know about you now.
Those were the jokes that were told at my dinner table.
Duh, crabs are lice. Pubic lice.
They are lice. Okay. I wasn't sure.
Yeah.
By the way, just so we're all very clear, that is not how you treat crabs or pubic lice.
It is why Lynn Kroll does not have an honorary
medical
MD.
degree. Right. She didn't earn it by telling jokes like that.
She just didn't. But we're going to move on to what's called an acute scrotum. So these are the things for which you call your pediatrician and or go directly to the emergency room. So, and I've seen these many times, actually. They all present very similarly. 10 out of 10, worst pain of my life, in the corner, crying, clutching the groin, sometimes nauseous or vomiting. Like dramatic. This is not, generally speaking, this is not subtle. So what are the causes of this degree of testicular pain? It's really two categories. It's infection or torsion. Which one do you want to do first?
Torsion.
It's
too cool a word not to go first.
It's awesome. So testicular torsion. The testicles, in addition to going up and down, are able to spin on their axis. Okay. Now, they don't do this very often, but they have the capacity, which is maybe why men think they're magical.
They're the figure skaters of the body.
Oh, that is new.
I'm just like picturing testicles with like a tiny pair of skates.
It's amazing, Vanessa. I have a new image for figs.
Ripe figs
to the side
on tiny skates. There you go.
So the testicles are hanging from something called the spermatic cord. Okay. And that's the section, like as the vas deferens is coming out of the epididymis, that is the area is called the spermatic cord. And the spermatic cord, it's like, it is what it is. It's a cord. It's what is the testicles literally suspended from this. And there is some capacity for the testicle to spin clockwise or counterclockwise. If the spermatic cord, if there is enough of a twist that the spermatic cord's blood supply, the arteries and the veins that are leading to and from the testicle get twisted. I want you to imagine like a yo-yo, and you're holding the string on your finger and the yo-yo is all the way at the bottom, and you know how it spins like crazy and does that thing. And the cord, the spermatic cord cannot handle those zillions of spins that the yo-yo cord can. But you know how you get to a certain critical mass point where the yo-yo cord has had it? The spermatic cord can tolerate a little bit of motion, but enough motion and the blood vessels get kinked. They get twisted, and they cannot supply the testicle with the blood and oxygen the testicle needs, nor can they drain the venous blood that has the oxygen sucked out of it properly. That is a surgical emergency. If the testicle twists enough that it gets starved of its oxygen, it often cannot untwist. The testicle will die. Now, it can spontaneously untwist, okay? Because if it can move one direction, it can move another. And there are certainly cases where someone will end up in the emergency room and they're diagnosed with torsion. And before they ever get to the operating room, it untorses. But for the most part, if you have enough latitude for movement, then it will torse again. At some point, it will twist again. And so the treatment is to essentially tack it down so that it doesn't have that degree of spinability. And actually, depending upon someone's anatomy, they may tack down the other side too. You can get ovarian torsion, Vanessa. So talk about parallel universe. Ovaries can twist in the same way that testicles can twist. They just don't do it quite as often because, as you can imagine, they're sort of ensconced and they're not hanging out and they're not sort of capable of that freedom of movement in the same way. But that you can absolutely have ovarian torsion in the same way that you have testicular torsion. So testicular torsion, if your testicle is starved of oxygen and if it dies, that testicle cannot produce sperm, full stop. Now you have another one, hopefully on the other side, that can do that job. But this is a very big deal. So
right. So if
torsion.
you have a kid who's complaining of real testicle pain, as tempting as it might be to tell your kid to suck it up and it's probably fine, it's not a big deal. What I'm hearing, Cara, is actually this is something to take very seriously. And if you can get in to see your pediatrician, great. And if you can't, this is a time to go to the ER.
And this is not like it's 9 o'clock in the morning, I'll wait till after school pediatrician visit. This is, can I come in right now? If your kid will let you look, you might see swelling, you might see discoloration. When there's ischemia, when there's no blood flow, the testicle and the scrotum can actually look purplish. So, but maybe they do, maybe they don't. So that's torsion. That's a surgical emergency. The other emergent finding, the other emergent diagnosis is infection. It's not that the testicle itself gets infected. It's usually that the epididymis, remember the lumpy area where the sperm gets stored, the epididymis gets infected, or the epididymis gets infected and then the testicle itself will get infected kind of secondarily. So epididymitis and orchitis.
What causes the epididymis to get infected?
So there's a long list. It can happen from a urinary tract infection. It can. But the more common causes are sexually transmitted infections.
Okay.
So, if someone has epididymitis, and sometimes it's hard to tell the difference between a torsion and epididymitis. So what do? They put an ultrasound on the testicle. They're looking to see what the blood flow is, right? Because you now understand that the blood flow is compromised in torsion. In epididymitis, you can usually see a very big swollen epididymis. The presenting symptom can look the same. I'm literally, Vanessa, I can remember the last time I saw someone in the ER with this, the presenting symptom was what my very first attending physician in medical school told us to look for, which is someone hiding in the corner, sobbing. Like literally, I walked into this I pulled back the curtain in this emergency room area and I saw the kid, in the corner, I saw just his back and he was sobbing. I was like, oh, I remember
I know
this
exactly
from medical.
what this is.
I mean, right? Just, it's so painful.
What if a kid gets kicked in the balls, hit in the balls, like that kind of situation?
So that too can cause an acute scrotum. First of all, this to the comment towards the top of the episode about if you weren't born with the anatomy, sometimes it feels hard to relate. So those of us who don't have testicles have seen 1,000 times images of people being kicked in the balls, kneed in the balls, right? Walking into it, and they're just doubled over with pain. It is hard for us to imagine that degree of pain, but it is so intense, and it usually causes someone to double over, and it can cause them to vomit or pass out very acutely. But in some cases, trauma can lead to rupture.
Right.
And that will be ongoing pain, and that will not be subtle. And it's the same. It's like, we're not talking about a kid who says, Mom, I think my testicle hurts. We're talking about a kid who is inconsolable.
And how do you treat a ruptured testicle?
Surgically.
Okay. And can it be repaired?
Yeah, these are all surgical emergencies. And depending upon, what the degree of the injury is, a surgeon may or may not be able to salvage a testicle. But, again, because this is the home of the sperm and the home of future fertility, it is really important to take these concerns seriously. I want to land with a comment you made about testicular cancer and fertility, and circle back on all of these topics and fertility, because you nailed it when you said these are topics that we often don't talk about with kids. We don't think about future fertility. We think about the acute situation right now.
Right.
But it's really important to recognize that the body is designed with two of a lot of things: eyes, ears, nostrils, breasts, ovaries, testicles, for a reason. There's the redundancy allows us to have a problem with one and to not totally lose the functionality. But if you have a kid who has been diagnosed with anything that from an acute scrotum to testicular cancer, it is totally appropriate to ask the healthcare provider, and usually at this point, it's a urologist. It's someone who actually specializes in the reproductive system, male reproductive system, and the urinary tract, to ask them, do we need to think about future fertility? Is there any reason why we should think about having this child put sperm aside in order to guarantee that down the road, he can have genetically related children should he choose? And it's an important conversation when they're teens. It's a complicated conversation when they're tweens or younger, because remember, puberty is the path to sexual maturation. And there's a point at which there aren't even viable sperm. And then there's a point at which there are viable sperm, but I want to think through what that conversation sounds like. How does someone get sperm out? They ejaculate. At what point are you having, the whole conversation with, it's unimaginable with a 12 or a 13-year-old about how you actually collect those sperm. And I actually don't know how those conversations go.
I was going to ask, right, the conversations, but also before a kid is able to ejaculate and has sperm in that ejaculate, because there's a point in puberty where the ejaculate doesn't actually have sperm in it. Is there a way to kind of harvest those sperm cells for future fertility?
Yeah. You are now reaching the limits of my knowledge, and I'm very excited to ask listeners to chime in. There is a sperm retrieval surgical procedure where you can extract sperm from the epididymis. So that is, my guess is that's the path of conversation at this age as well. But beyond understanding that the procedure exists, I actually don't know a lot about it. So I would love to invite listeners to share their knowledge, email us, DM us, teach us. If you work with tweens or teens, especially ones who are managing the after effects of an acute scrotum or who are being treated for testicular cancer, I would love to understand what the standard is now. And is it just straight up sperm retrieval?
I mean, Cara, we've covered a lot of ground here.
Yes.
On an episode where people might have initially thought, well, what is there to even talk about? Now you know there's a lot to talk about. Just as much as your son can spend endless hours with his hands down his pants, hanging out with his friends down there, his balls, his testicles, God knows what else they call them that we don't even know the names for.
Yeah, exactly. Send us those DMs too. We often say, share information with your kid. This is an episode that I think is completely appropriate to share.
And I didn't even swear. This isn't even an explicit episode.
Miracle of miracles.
No profanity. I'm getting better. I'm capable of maturity. Please DM us with additional resources. You can DM us at less.awkward on Instagram. You can email podcast@lessawkward.com. You can join our membership so you have all of the diagrams and information you need about male anatomy right at your fingertips. Sorry. Again, I'm sorry. Someone should take account of how many puns there are. And yes, we want to hear from you. And maybe there's experiences you've had with your kid that we didn't cover that you think are worth addressing. So please be in touch. Cara, as ever, it is a pleasure.
Bye, Vanessa.
Thank you so much for listening. You can email us with questions, feedback, or episode requests at podcast@lessawkward.com.
If you want to learn more about what we do to make this whole stage of life less awkward for everyone involved, our parent membership, our school health ed curriculum, our keynote talks, and more are all at lessawkward.com.
And if you want products that make puberty so much more comfortable, visit myumla.com.